Hola, por favor, siéntate. Mm. Disculpe la molestia. La voy a tener que referir con un doctor para que la examinen. Entiendo que vino conmigo por el dolor en la pierna, ya que pensaba que era relacionado al fútbol. Desafortunadamente, no creo que esa sea la causa del dolor. De acuerdo a los exámenes realizados, puedo que tenga un tumor presionando los nervios. Estos casos los he tratado con varios atletas y aunque es común de tratar, me gustaría mandarla con un doctor. El doctor le podrá hacer una radiografía y exámenes adicionales para tratar a la pierna. Le puedo ayudar a hacer una cita. Cualquier pregunta. What is health literacy? Health literacy is the ability for people to comprehend care and make educated decisions based on that literature. However, language barriers aren't the only thing that influence health literacy. There are things like poverty, low education levels, comorbidities, poor access to healthcare, age, and racial and ethnic minority groups that have been linked to low health literacy. We're going to cover the first four things, but kind of littered throughout the two major ones that I'm going to talk about. It's age and racial and ethnic minority groups. So let's talk about facts about race. There are two major minorities that really get identified: African Americans and Latinos. Now, African Americans were found to have consistently low literacy levels across many different studies. They had thought, since health literacy was linked to low education, that if we were improving the education of these individuals, that maybe health literacy would follow suit. Upon closer inspection of that, they were looking at college sports and seeing if that was a way to engage African Americans in increasing their educational levels and therefore improving their health literacy levels. However, they found that sports were made a higher priority than the actual education itself. They weren't graduating at the same rates that their white counterparts were. And so the actual sporting event. So what do we need to do? We need to consider educational materials, things that we can hand out to them, to these individuals that would help them improve their ideas of, what's going on with them. Age was found a significant factor in whether people had high or low health literacies. You are considered to have a low health literacy if you are at a 9th grade reading level or lower. Moving into age, there was a statistic that 40% of people over the age of 65 read less than a 5th grade level. So low. Some examples to provide context for this. A TV dinner, the directions on a TV dinner is around an 8th grade level of reading. Directions on taking over-the-counter medications, that's at a 10th grade. If we can't expect that 40% of people over the age of 65 are able to understand the directions on a TV dinner, we can definitely see the disparity our older population. And granted, with low health literacy is linked with more ER visits, because people are waiting until things get worse. So they don't want to operate through the healthcare system. Also, it's linked to having poor access to healthcare. They don't take the time to shop for the right doctor. They don't take the time to engage in preventative things like getting flu shots and other vaccinations. Or maybe it's that they just don't have any insurance. All of those things are linked with low health literacy levels. So if they aren't engaging in all of those things to keep them healthy, then low health literacy is being considered a risk factor for leading to other health problems. Age on the opposite side of the spectrum is just as bad. We're talking about children. Um, One of the interesting facts that was brought up was we educate a child so that the child is able to cope with their illness. We educate the parent to ensure that treatment regimens are adhered to and followed. Getting back to that whole low, if the parents have low literacy, they're not going to be able to recognize the long-term effects of chronic illnesses. They might not be able to understand the importance of prevention. They might not be able to understand how those health problems would. So making sure that these parents are knowledgeable in not only why all the treatment measures are important, but also how to incorporate those treatment methods, um, then we're going to increase child adherence to treatment plans. So what can we do to help? There were a couple of interventions that we can, as healthcare professionals, can take on. The first of which is that we need to educate healthcare programs about the disparities that are in healthcare, and understanding health literacy and what's causing the differences in health literacy. You know, any population that you serve, ensuring that you have literature that you can pass out to people that's in their native language, as well as English, is going to ensure that they have materials, education materials they need. Checking for the reading levels of the literature that we come out, turning our big healthcare words into smaller words, anything that's over or three syllables, definitely over, bringing those down, adding more pictures to our literature, creating more white space so that we're not overwhelmed by all the things that the literature is presenting. And then, of course, repeat ourselves as we're educating those things, to solidify the same messages over and over again. All of these things will help improve health literacy for all individuals, because every individual deserves to understand what they're going through and how to help themselves.